good afternoon, everyone. It's Madeline with Together SC. We're thrilled to have you with us. Please mute your lines. But of course, we love seeing your beautiful faces, Mamie Nichols, so that we can connect at least a little bit. And you know what we like to do. We like to share in the chat your name, your organization's name, what community you're in, or what community you're working with that you know doesn't, in this case, doesn't have broadband access. That might be helpful to share. If you're an internet service provider, please share that as well, what areas you serve. So we'll be having really the conversation on Zoom, and then we will be able to pick up Q&A from the chat box. When you have a question, if you will please start your question with a Q, so it'll stand out from the other chats. We will be recording today's call so that you can have it as your point of reference. So let us get started. So I just want you to know how very excited Together SC is to be hosting this call with two of our favorite partners. First, Bernie Mazik and his Association for Economic Development, with whom we have worked for many years and is a real powerhouse in the effort of community development. Bernie, welcome. Good to be partnering with you today, and thank you for leading our nonprofit panel.
Thank you.
Good, good. And then, of course, none of this would be possible if Jim Schwartzinger and his team over at the Office of Regulatory Services and Broadband hadn't been working so hard to have the state of South Carolina understand the significant gaps that we have in broadband service across our state, and to have them allocate, what was it, Jim, nearly $500,000 in ARPA funds, half a billion, excuse me.
$400 million.
$400 million in broadband funds to help provide access to underserved communities. The objectives for today, and Jim will be leading a panel of the ISP providers. You can see the agenda on the screen, hopefully. Jim will introduce his panelists when he speaks, and Bernie will introduce his panelists. But let me say welcome to our panelists and thank you all for helping. Another sort of key member of this team is Kathy Schwartzinger, who, like Bernie and myself, serve on the Broadband Advisory Council. Did I get the name right, Jim? No, you'll have to correct it.
Kathy Schwarting. Yeah.
Schwarting. Oh,
listen, it's been mutilated a lot worse than that, so I can live with it, actually.
Did I get the Broadband Advisory Council name right?
Yes.
Okay, 1 out of 2. Sorry about that, Kathy. Anyway, when Jim got started, one of the first things he did was put in place a council of not only other state agencies and the for-profit sector, but also the nonprofit sector. And Jim, I just want to say how much I appreciate the effort of the agency to use across-sector collaboration to help guide this effort. We need more of that in this state, and I hope that the benefits of our working together will encourage others to take similar collaborations to heart. So our goal is that those of you working in nonprofits and in the communities with philanthropic partners who know your communities and know the impacts of lack of service and access on those you serve will now be able to connect with the internet service providers in your communities who will be applying to the Office of Broadband for funding for expansion projects. And we want you to connect to help them strengthen their applications, because as Jim will tell you, you're an important part of that. However, we will also say that there is not money in this for the nonprofit sector to do the access. That's something Together SC is working on, and we'll talk about later in the effort. So with that, Jim, can I turn it over to you, and will you get us started?
Absolutely. And Madeline, thanks so much. It's been a real, first of all, it's a pleasure to be part of the Office of Regulatory Staff. My home agency, and I think our executive director is on the call today, so I'm glad she's joining, as well as other team members. But the General Assembly wanted us to all talk together. They wanted, broadband is in fact a team sport, and we want to have all of the voices engaged in lifting up our communities. And we've been meeting for many months with the Broadband Advisory Council, and we finally found a way to build the bridge between the nonprofit community leaders. And we wanted to start the discussion and get us launched today. So we're not going to answer all the questions today, but I think this will be the start of a rich dialogue that we'll have over the next 5 to 10 years as we lift up the state of South Carolina and improve connectivity for everybody. So again, the agenda is we're going to have I'm going to start with a couple of slides, switch over to that in a second, to kind of show you the grant program that we currently have. We're going to do a panel of the internet service providers, and then I'm going to pass the baton to my good friend, Bernie Mazik, who's going to lead a panel of the nonprofits. So I think this will be a nice bi-directional conversation. That's the intent, and we'll see how it goes. So bear with me 1 second. I'm going to close this screen and launch some slides. If technology will work. How are we doing? Okay, everybody see? Great. All right, so I'm going to dive right in because I know we've got a short amount of time, but let's start with the technical details of the legislation, just we set the stage. As Madeline mentioned, we're incredibly grateful for the support of the South Carolina General Assembly and the governor's office, and we have never seen alignment from our elected officials like we do right now on this particular topic of broadband. So House Bill 4408 was enacted on May 13th, and that allocated a bunch of ARPA money, but it's specifically for broadband. It allocated $400 million for broadband infrastructure in the state of South Carolina. I won't get into a lot of the technical details because it's way more than we have time to talk about, but there is $214.2 million of state fiscal recovery fund and another $185.8 million of capital projects fund. So what we're going to talk about today is this piece right here, the state fiscal recovery fund, because that's what's in front of us right now, and that's on the front burner, and that's the reason for this discussion today. So one of the things that the Broadband Office is really proud of is we've developed extensive mapping capabilities for the state of South Carolina. We have a website called SC Digital Drive, and I'm going to ask one of my colleagues to just type the link for that into the chat so everybody has it. But I'm going to just talk about the mapping the planning slide for a minute, just to kind of set the stage for where we are in South Carolina. When you look at this map, the green areas on the map are already served. The white areas on the map, nobody lives there. And then everything else, I always tell people to look for the freckles on the map, because these are the places where there's a lot of homes and the internet service is not that great. You're also going to notice on this map that we have blue areas. Those are places where the federal government has made investments, and yellow areas, excuse me, those are the areas where the state of South Carolina has made investments. So it's very important for the Broadband Office to be aware of both of those things so that we don't step on each other's toes. The whole idea of this is to pay very careful attention to the precious financial resources we have. And there's no sense investing on top of each other. So we have a close coordination with our federal project partners, the U.S. Department of Agriculture and the FCC. We're very aware of their efforts. And of course, we're very aware of what we're doing too. So you can kind of see how these puzzle pieces make their way. So I think some of you may not be aware. So I thought it would be fun, or at least interesting, to share a slide. These are the current statistics for the state of South Carolina. We put these together every 6 months. We're going to update these numbers. But for right now, I'm just going to focus on this one number right here. There's currently 181,715 housing units in South Carolina. This is as of our March 31st, 2022 statistics, 181,000 roughly housing units in South Carolina that do not have access to 25.3 service. So 25.3 is a measurement of download speed and upload speed. And it is the federal standard, the bar, if you will, by which we measure service levels in the United States. So that's our current number. And you remember, we made some investments. You can see the yellow and the blue. So we're projecting as of January 1st, 2023, that because of those investments, we will have drawn the number down to 157,000 homes in South Carolina. It's still a huge amount of work, a lot to do. And that really leads us to the next slide. We want to, the whole purpose today is to have a discussion for how we can have our nonprofit leaders talking to our internet service providers to make more compelling grants. We don't want to deploy infrastructure for the sake of infrastructures, for the sake of technology. We want to deploy infrastructure to lift up human beings, to lift up the quality of life, to lift up the quality of healthcare, the quality of education, the quality of economic development. And so the South Carolina General Assembly put forth some requirements for us that we are required in state law to prioritize unserved blocks and census blocks, and that's a measurement of geography. But we are required to look at census blocks that have K-12 students, a lot of students living there. So we're looking for more than 20 students. I'll show you a map of this in a minute. There's 3 criteria. Either one of these criteria by themselves identify a priority area for investment. So more than 20 students, a difficult development area. Some of you are very familiar with community development block grants, and you've heard that lingo before. U.S. Housing and Urban Development has defined specific geographies in the United States where CDBG funding goes. And then last but not least, the third criteria, no internet service provider at all. And a lot of people don't really realize this, but there are parts of South Carolina where affordability has nothing to do with this. You pick up the phone and you try to call an ISP, and there's literally nobody there to take your call. They don't exist. So we'll talk more about that in a minute. But so we, the Office of Regulatory Staff, the Broadband Office, we opened up a grant round where we are going to award approximately $180 million of ARPA funds. Remember that 215 I showed you? We are going to award approximately 180 million of that, and they're going to be all over the state. So now the question is, where are we able to make those investments? So you see this map, we call it the eligibility map, and all of the internet service providers are definitely aware of this map right now. They've all been briefed on it. But when you see the dark red areas on the map, those are high priority census blocks, meaning they have students, they're difficult development areas, or they have no ISP at all. So that's those red blocks. Then you can see the pink blocks. Those are everything else. So the red and pink are fair game for our grant program. You'll notice the yellow areas. These are places that we've already made investments. They're considered funded already. So we're not going to double up and invest on top of those. So I hope this gives us kind of a framework for our discussion as we dig in. I want to make the point that the broadband investment dollars are infrastructure only dollars. So the eligible applicants for the ORS grant program are internet service providers, and they must offer residential service. They must participate in, they must offer a high-speed internet plan that's affordable for all residents. This is not an income-based qualification. And they must participate in the affordable connectivity plan that the FCC offers. So as providers put forth a project, we are requiring that they impact at least one of those dark red boxes. When they create an engineering region, it has to have at least one of those. And when they build out their project, they have to serve 80% of the housing units in the project area. And they have to use technology that meets or exceeds 100/100. That's kind of a nerdy term, but that refers to the download speed and the upload speed that the federal government requires for new construction. And here's kind of a key thing, and this, for the nonprofits out there, we're not allowed to invest money in places that are already served in the United States, kind of for obvious reasons. The whole purpose of this investment is to lift up the areas of the United States that have not had any love in previous years, right? We're trying to, give everybody a shot at the digital, at a new life. So the scoring criteria, and I want to draw your attention to item number 6. I've got it circled in green. As we look at grants, we are requiring that all of our ISPs, when they make grant applications, is that they crisply and carefully delineate their relationship with the community. And that's why we're on this call. We want the internet service providers to very carefully talk about their relationship and how their collaboration is going to take a project to the next level. So we're going to have a discussion in a minute, but here's another key piece, is that the applications are due on August 31st. So I know Stephen and Amy and Glenn, they're all going crazy right now, trying to get their applications together. They're kind of laughing at me right now, but there's not a lot of time to get these applications in. And so there was some urgency to get this call out there to build the bridge. And hopefully you guys can come together and come up with some neat ideas for how to work together and extend the grant programs. So with that, I'm going to stop sharing the slides, and I'll ask my 3 panelists to come off mute if they could. And I'm going to just ask them to introduce themselves one at a time. And let me start first with my lady on my panel. Amy, could you say hi to everybody?
Hello, everyone. Good afternoon. My name is Amy Averill, and I am Vice President for Regulatory Affairs for Comcast, covering South Carolina, among other states. And I've been with the company for 8 years and have definitely enjoyed my activity and my interactions with the folks in South Carolina, and really looking forward to talking to you all today and continuing to pursue new partnerships.
Thank you very much, Amy. How about Glenn?
Sure, I'm Glenn Martin. I'm CEO of Carolina Connect. We are a not-for-profit internet company that was started by Mid-Carolina Electric Co-op. And right now we have 3 partners. We serve Mid-Carolina Electric Territory, Newberry Electric Territory, and Aiken Electric Territory. So if any of you are in those 3 areas, I would love to talk to you about your internet needs in those areas. But we provide those services in those electric co-op territories.
And Mr. Stephen.
Good afternoon. I'm Stephen Taylor. I'm the Community Affairs and Economic Development Manager for WCTEL, WC Fiber, and Upcountry Fiber. We serve 7 counties in the upstate. Just like Glenn, we have a unique partnership with Blue Ridge Electric Co-op and serving the Pickens, Oconee, and Northern Anderson area as well. But I'd love for anybody in our area to reach out if we can help in any way.
Well, thank you all for joining me today. And we're going to dive right into some questions and try to move through this fairly quickly. But just to reiterate some of the things I mentioned before, the ORS grants are only available to the ISPs. So the eligible applicant for our grant program, our 3 examples are Stephen, Glenn, and Amy that are here today. And the grant application requirements stipulate that there has to be a strong articulation of community relationship in the grant program. So one of the things I wanted to talk about, and I'm just going to ask some questions of the ISPs, but a lot of nonprofits don't know that the grant process is really competitive and very confidential. And Stephen, since you introduced yourself last, I'm going to come to you first. And why don't you tell everybody what it's like to be in the competitive ISP world and why you need to be careful with confidentiality and things like that?
Yeah, this market's very competitive and, it's like other utilities, we don't have assigned territory, so we are very competitive. And we just try to evaluate everywhere that we're deploying services. And, there's a business model we put together and we examine everything from how much it costs to pass per address to how much our penetration, basically our take rate will be. So it's very, very confidential because you're putting together a business plan and there's a lot of capital investment. And the return on our investment is a very long time in this business.
So you carefully pick your geographies that line up with where your existing infrastructure is, and you kind of edge out on your existing territory. Glenn, how about you guys? I know you carefully select and look at your geography as you're thinking about places to go next.
Sure. Well, we mainly focus on those 3 territories that I mentioned for the 3 electric co-ops. And we average about 9 homes per mile. So you got to think about how you would build into those areas. What's your payback over time? And we're building it for the long term. So we think people in rural parts of the state should have internet just as good as they do in town, in cities. So we're strategic about that. And we have to keep those things going to make it pay the bills is what we're trying to do.
Yep. And Amy, I know you all have worked with nonprofit partners, but I'm asking Amy, what kind of partnerships are you looking for when you think about deploying a new network in a new community that you've never been in before?
Right. Well, I want to start quickly by just talking about the importance of adoption. I mean, I think we've seen over the last couple of years that even when a network is available, a lot of community members, residents do not necessarily take advantage of that network that's made available to them. So adoption, in order to take advantage of the services that Jim highlighted, healthcare, access to jobs and workforce training and all of that kind of stuff, we want to make sure that particularly our low-income residents are educated and about what's available to them, and that they're given the digital skills that are necessary to take advantage of all the opportunity that broadband can provide. So certainly Comcast has a history in all of our areas across the country where we serve of partnering with community organizations, nonprofits like yourselves, to bring this awareness to the community and to actually provide a low-income, affordable plan. So we started Internet Essentials in 2011, which is actually the nation's largest low-cost broadband adoption program. My point in saying all that is that's the kind of work we want to continue. So we have part of the Internet Essentials program since 2011, and it has been continually updated and was just updated again this year to match up with the ACP Affordable Connectivity Program. Is low cost service, a subsidized device. Our Internet Essentials customers can get a computer, a laptop for $150. And then also working with community partners to provide digital skills, digital literacy training to the community. So I say that to say that that's the kind of partnership that we really value in the communities that we are currently in and that we are looking to expand into, is to make sure that we have the trusted leaders in the community. You all work with these communities on a day in, day out basis. And we want to partner with organizations like yours so that we can really meet people where they are, make sure that they're aware not only of the availability of the broadband that's being brought to them, the availability of the ACP program, because a lot of people don't necessarily know that that's available, and to help guide them along in the process. So we've certainly in the past, we've had relationships with organizations in our current footprint, like the Trident Urban League, where over the last 3 years, we've given them digital literacy grants, basically to partner with them in order to train folks in how to use the internet safely and effectively. So I think that's kind of a high level.
Yeah,
I
no,
may
that's
have gone
great.
on too long. I apologize.
No, that's okay, because it's kind of a nice segue to the topic. All along, when we make investments in infrastructure, we want to make sure that the residents can afford service when it comes to them, but we have to carefully manage affordability and sustainability, right? Because we just don't want to build a network that fails 10 years out. We want to build a network that has the horsepower to last the long haul. And Stephen, Stephen, Glenn, as you guys look at your areas, you got to think about storm damage. You have to think about customer service. You got to think. So how do you talk to us a little bit about the cost of building and what you're seeing on a per mile basis and those things?
Yeah, so we're a full fiber network, so we see about between $60,000 and $70,000 per mile just to deploy fiber. Now, that cost is not the cost to do a drop to a house or the equipment at the home or the equipment here at the back office to run that. And one thing that we noticed, like in some of these rural areas, that's our focus as being traditionally a co-op telephone cooperative was. When you start making drops to some of these homes in these rural areas, some could be a quarter of a mile off a main road. That's a lot of expense. So we're always evaluating that, and we're always trying to figure out a way how we can reduce costs, because at the end of the day, we're always looking at what our take rate. I know Amy spoke a little bit about the take rate. It's because that's what we're always evaluating. Is it because they just don't know what's available, or is it a situation where there's a cost situation? And that's something we're constantly evaluating, where we feel like there's a need and how we can best provide our services at the least amount of money. Jim.
Yep. Thank you, Stephen. How about Glenn?
Yeah, I agree with that. We've constantly try to look at, since we're a not-for-profit part of the electric co-op world, and we've constantly got to look at how we're utilizing the funds that are provided to each of our co-op to make sure that we can have a sustainability of a network to provide the service long-term and meet the needs of the future as well as right now. Used to that 25.3 was good internet back in the day. It's not now as we move forward. So we've got to constantly look at what's next.
Yeah, and Glenn, I'm just going to keep you rolling on that topic. When we put fiber in, we like to say fiber is kind of the future-proof technology where it's scalable for the future. Why is that so? Why is fiber future-proof?
Well, let me just go back to history, talk about history. I've been in the business since 1989, and the fiber that I put in, whether it was with a telephone company that I was working with or now, we've never taken it out unless it was damaged by a storm or a backhoe. So all we're doing is replacing the electronics on the end to get the higher speeds that folks need in rural areas going forward, whether it's doing homeschooling, whether it's doing business remotely in rural parts of South Carolina. But that fiber is future-proof in that we haven't found out the capacity of the fiber yet.
Yeah.
Exactly. Thank you for sharing that. Stephen, did you have something to add
Yeah,
on?
I could just, like Glenn said, DSL, there was some time we got 500, what more could you possibly need? But with technology just moving from appliances to telemedicine to, everything in the home is being operated through the internet or broadband. So, really it's taking on a shape, and that's why we feel like fiber is the future as well.
That's great. So, you all know I didn't ask you on this panel just because of your great looks and everything. I know you all are very talented and have worked with community partners for a long time. Could you guys each share, Amy, I'll start with you. Could you share some examples of nonprofit partnerships that have worked well for Comcast?
Sure. I mentioned already the Trident Urban League, and this mirrors relationships that we have had across the Southeast, across the country. But, I would say over the last 3 years, provided grants to the Urban League, totaling $55,000 to help so that they can actually go out into the community, serve their constituents by providing digital literacy training, kind of one-on-one, and classes, one-on-one, whatever it is, to make sure that both school kids and seniors and everyone in between know how to use the internet safely. A lot of our efforts have been in not just literacy, but how to use the internet safely. And because there's a lot of mistrust as well. I mean, and I don't need to backtrack with what I was saying before, but even when internet is available and even when free internet is available or effectively free based on the ACP, there is a bit of fear that some communities have in starting to use the internet, and that's where these partnerships are so critical. That, you know, and we're calling them digital navigators now, where we're partnering with individuals who can, you know, again, meet people where they are, speak the same language, understand what their fears are, and help guide them through the process step by step, not only in connecting, but then how to use the internet. So I like I said, I was just going to call out the Trident Urban League as an organization that we have worked with, and we've worked with the urban leagues across the country to
do some stuff.
bring
That's great.
skills and access to people.
So, Stephen, how about you guys? I know
So
you've done a lot.
Yeah, we've got a lot of programs. One, we've been partnered with some school districts on adult education for computer literacy classes that we've been hosting. We found that the baby boomers have really gone to that. Streaming is a big thing to get educated on that. We've also, during the pandemic, we worked with the school districts, and we actually launched 24 hotspots just in some really rural locations to help with some students to get by. One project we just wrapped up, we're working with the veterans to do a VA Telemedicine Center, and we've opened up 2 of those, one in the library and one at a VA office in Greenwood. So been excited about that. And going back to what Amy mentioned earlier about ACP, really looking for nonprofits to help us with that. We've worked with First Steps Group. We've worked with the food banks, local food banks, basically getting brochures out. We're actually starting to do some radio ads, just discuss ACP. And it's just not for if they're our customers. Majority of the providers in our area are offering ACP. So it's really community involvement and making sure people take advantage of that.
Thank you, Stephen. Why don't you bring us home, Glenn?
Sure. Since we serve really rural areas that the for-profit power companies didn't serve, we serve really rural areas, and we've got a couple things. One, I can't focus on enough about how that ACP plan has helped a lot of people in rural parts of our service territory, and us hand-holding them to get through that approval process. Because it is a federal government program, they need a little hand-holding to get that done. Number 2, in some rural community clubs and those kind of things, centers of our rural communities, we focused on providing internet those areas so that they can get that digital training and literacy there as well. One thing that has been very rewarding to us is we've had a lot of churches in rural parts of our territory who have provided Wi-Fi for folks in the community who could not have internet at their house. And that's been very rewarding to see how that's been done to give everybody a chance, especially with COVID going on, that people can pull up in the church parking lot and get internet access so that they can do the things that they need to do.
Fantastic. And we're going to wrap up the ISP panel. I want to thank Stephen, Glenn, and Amy for joining me today for this. But one thing I wanted to say is, how do we best get in touch with you guys? How would you prefer that, a nonprofit world reaches out and connects?
Well, they can reach out to me personally or anyone in our office. Usually I'm the one that handles an office, so they can reach out to me. And I'll actually put the areas that we serve in the chat as well.
Great. And I think, one thing we'll say from the broadband office perspective, we're happy to connect the dots. If there's a nonprofit out there that would like to reach out to a specific internet partner, that's what the broadband office is all about. We'll help you bridge that gap. If you have a particular type of service, if you know somebody directly, you can do that. Glenn and Amy, is there a best way to connect with you guys?
I was going to say, I'm happy to have people reach out to me directly, and we have a team working in South Carolina, and I can connect anybody. I'll put my information in the chat as well as where we currently serve.
Hey guys, thanks so much. We were going to stop Jim at this point and have questions, but we're about 10 minutes behind schedule, and I want to hear from Bernie and his team. So let me reiterate, put your questions for the ISP providers in the chat box. We'll get to those at the end. ISP providers, if you want to start answering them in the chat box, have at it. Bernie, will you introduce your panel? Thank you, Jim.
Sure. And good afternoon, everyone. I want to start by thanking Madeline and Together SC for hosting this awesome webinar and conversation. I want to thank Jim Schwartzinger, the head of the Broadband Office, for his leadership over the years that we could not have a better ally in the Broadband Office. We're fortunate to have, as a part of our panel, leaders from the nonprofit sector that works already in broadband. You might think that broadband is only for the ISP and the technicians, but we have leaders that have already been leaning into the issue of broadband and access to broadband. We have Kathy Schwartzinger with Palmetto Care Connections. Kathy has been leading this work through that organization for quite some time, and she's demonstrated how she's been able to move this issue forward in a dynamic way. We also have Phyllis Martin, who's CEO of the Tri-County Cradle to Career, headquartered here in the Charleston area, also leaning into the importance of broadband to providing education and holistic community development. And finally, we have Paula Gutierrez with the Office of Rural Health. Paula is the Rural Health Action Plan lead strategist and knows everything rural and broadband. So we have some powerful folk that are going to talk about the nonprofit's role in connecting broadband and connecting the ISPs to the community. And I'm going to ask each, if you could just say for a moment, talk a little bit about why your organization has leaned into broadband. And I'm going to start with Kathy.
So thank y'all for asking me to join. I appreciate it today. I've worked with Jim a long time, worked with Phyllis, worked with Paula. We all kind of work in the same circles. So Bernie, appreciate you putting this all together, you and Madeline. So in 2010, my background is rural health, physician recruitment, hospital management. And we started Palmetto Care Connections as a telehealth network, trying to really get the providers, the healthcare providers, to adopt telehealth. And as we got into that arena, we realized that broadband was a major barrier. Quite honestly, 10 years ago, not just on the patient side, but on the healthcare provider side. We have lots of FQHCs in the state who didn't have enough broadband capacity to offer the diverse telehealth programs that they wanted. So with that being such a barrier, we actually transitioned the management and administration of a broadband consortium called PSPN over from the Medical University of South Carolina to PCC. And in 2015, we began administering that. And what we do is to help through the FCC's Healthcare Connect Fund, we help eligible healthcare providers to receive broadband subsidies. I want to say to date, I think we've saved the healthcare providers about $35 million. So it's not a small program. That helped us to establish our relationships with most of the ISPs in the state. We actually do this in multiple states. So we typically have a relationship with a lot of the ISPs. When COVID hit, we started getting lots of calls from patients wanting to do primarily telehealth visits, but they didn't have a device, they didn't have internet at home, they didn't know what a telehealth visit meant. So we take the approach for broadband from a healthcare perspective, although we know it's economic development, it's school, it's farming, it's all of the above, but ours comes from healthcare. And so we really started looking at a lot of our folks that were socially isolated during the pandemic. And in working with the South Carolina Department on Aging and another fabulous nonprofit that is a national nonprofit called Rural LISC, we developed a social isolation program where we trained 100 senior citizens on digital literacy. We taught them how to do telehealth. We taught them how to use Zoom, how to connect with their friends and family. That whole social isolation is a mental health issue. And our mental health rate soared during COVID. Our depression rate soared. So not just physical, but mental health. That expanded. We gave them a device. We taught them how to go online, research health information. And so we taught them the basics of how to use a device. We taught them the benefit of having the internet. Some of these seniors had never thought about their need to have the internet. And then when we taught them how to use Pinterest and go online and read, honest to goodness, go online and find recipes, they were amazed at how it opened up their world. So that led us into doing work in the low income household area. So we have done a lot with low income households. We've just gotten some money from Health and Human Services to focus on the Medicaid population. And last week we taught an LPN class. You would never imagine that students and older adults going back to school to be nurses would need digital literacy, but a lot of them did, and a lot of them did not have devices in their home. So if they completed our digital literacy course, they received a free device. We helped them to get internet in the home. If they could not, for whatever reason, I think to date, we've given out about 100 hotspots to allow these folks. We don't want to teach them. I think it was Amy that talked about we tell the legislature all the time, building infrastructure is great, but adoption is key. If they don't adopt, that fiber optic cable is just sitting out there in the road and it's not affecting any lives. So helping them to adopt, teaching them cybersecurity, how to be efficient, how to be safe, teaching them all of the above. We've probably screened maybe 1,000 folks across the state in these rural communities. And I think to date, we've trained about 500 people. And I think we have enough on our plate for about 3,000 more that we have some funding to train. So a lot of these folks, we try to teach them easy ways to do things so that they don't have to download applications and stuff. We teach them and help them set up email. When the vaccine came out, our seniors had to register with an email address. They didn't have email. They didn't have a device. They didn't have internet. I mean, talk about the gaps in care in these rural and underserved communities. That just exacerbated what our problem was before COVID hit. So,
and we all know how vital during COVID the internet and broadband was to just connecting, just being relevant, just being part of what's going on in recovery. This is phenomenal, Kathy. Y'all have done a phenomenal job in moving internet and making it practical to everyday folk in the community. And we're going to transition a little bit to education and Phyllis and what you all have done through Cradle to Career.
Yes, so thank you, Bernie, and I echo Kathy's thanks to Bernie, Madeline, and Jim, of course, for having us. And I'm going to echo a lot of what you heard Kathy say, but Tri-County Cradle to Career, our mission is to build collective power to transform education by changing systems to allow Black and Brown children to achieve their goals. And we understood very early as the pandemic was coming in, so early 2020, through a series of qualitative and quantitative data studies that we did, and some very early maps, that digital equity and inclusion was the systems lever that was impacting, always had, but really now the light had really been illuminated what was happening for children and families, and was the systems lever that we needed to focus on, not only for our mission for children, and education, but as Kathy's already pointed out, for the systems that surround children in education, healthcare, transportation, housing, digital literacy, financial literacy. And we tied that to resiliency. And so we understood very quickly that digital equity and inclusion has a very strong tie to the region's, if not the state's, resiliency. And so we put together as quickly as we could, quite honestly, a digital equity and inclusion framework that includes 4 dynamic domains. One, to build a tri-county digital equity coalition that would set direction and drive community priorities and projects. And even as we heard Kathy saying, and really everyone that has spoken so far, there is a lot of amazing work happening, albeit in some instances and not on purpose, but disconnected. So we also want to build the capacity of community leaders and organizations to advocate and to support digital inclusion and navigation with their communities. The third area is to align resources and build additional capability to deliver programs and supports, and then to create a shared measurement plan and track results. And the four ways we know to do this is through capacity building of communities, organizations, and community-based organizations. To focus on and ensure, as Kathy's already stated, adoption projects. And I will only reiterate what you have heard. Access will not equal adoption. Work has to go on the ground in communities, driven by communities, if we want that sustainability, and we want what our internet service provider friends want. We want to see an uptick in usage and sustainability. So capacity building and adoption rates, technology. So families and children have the right number and the right types of devices per household. And of course, as Jim always says, and it really is important, we're not really going anywhere without connectivity. So taking and making sure that we have a focus on connectivity. I think we were one of the first to reach out to the ORS before, even though we had been in contact with Jim before there was an office of broadband, and base this coalition work on public-private partnerships. So today we're working in 2 communities. We have a plan in place and are pending some conversations with Charleston County Council to expanding to 4 additional rural communities. So Paul, I can't wait to get on the phone with you and have some conversations. Kathy's been an amazing resource. Comcast was actually the first in to upfit the St. Julian Divine Center in the east side of Charleston on the peninsula, to make sure that they had the highest speed internet so that we can align those adoption activities, digital literacy activities, healthcare, online banking, whatever the community tells us that they need. And I think I will just close for a second by saying we have a solid logic model and measurement plan in place so that we can track not only outputs, but outcomes along the way. To the ISP's point, we want to look back and say, what difference did the infrastructure make? We want to be able to look back in 5 years and say, what is happening? What difference did it make across multiple domains? But that work has to be driven by community voice and what communities need to achieve their goals.
And Kathy has laid out just fantastic outcome measures just from the health area.
That's right.
Phyllis, you have just laid out from an educational standpoint, an educational lens, the critical importance of systems, because if we're not able to really engage the internet, it's like rural electrification before us. We realize that that's a true utility. Broadband is utility. It's a vital part of our life and our system. And Phyllis, you've already prompted the discussion about rural for Paula, because the Office of Rural Health has just done a phenomenal job in engaging in broadband activities. So Paula, can you just talk a little bit about the leadership you all are giving in that space?
Thank you, Bernie, and thank you everyone for the invitation. The South Carolina Office of Rural Health loves to be in the conversation because our mission is to close the health status and quality of life gap between rural and urban communities. And I think one of our first investments in broadband was with Jim in partnership with PCC, Kathy, and the South Carolina Hospital Association with the creation of the first maps of South Carolina, because we knew that it was important. We knew that for our rural communities to thrive in healthcare and in all of the different resources that we help them to acquire, that internet was a must. And connecting available resources and also improving the social needs and social influence that that Jim started talking about in the beginning. Internet as it relates to health, to education, and everyone else's mentioned today. And through this investment and also through this role that I have as the lead strategist for the Rural Health Action Plan, we looked at, what is actually affecting the rural areas. And so we created this Rural Health Action Plan to look at access to healthcare, community engagement, housing, economic development, education. And we have the flexibility. We're 3 in the nation of the offices of rural health that are a nonprofit, and we have the flexibility to get into the community and be creative. We have family solutions that are very community-based. We have the health coalitions. We have an amazing community team that works hand in hand with the community, and we've been doing it for a few decades now. And specifically to broadband, two outcomes that I can speak to are the economy ecosystem and also the CDC Health Equity Grant. And the digital economy ecosystem is a project that we looked at in partnership with the South Carolina Rural Innovation Network to develop community planning, leadership connections, and roadmaps. So it's a very nice complement to everything that everyone else is doing. So what is the digital economy ecosystem? And it's coming into communities that are ready and have leaders in place who are interested in developing a community plan and roadmap. And so it's a process that includes, thankfully, SCACED and the Broadband Office, where community leaders are brought together. They receive the broadband community champion training. And then from that point, the South Carolina Rural Innovation Network conducts a series of interviews in small groups. And through those sessions, there is a document developed for each county to lay out what is the best plan. And that is with the expertise of Jim and his team, and also with any other partners that come in and give resources. I know that Kathy has been a great resource with the digital literacy, and we love it when the stars align. And let's say in Orangeburg, there's a digital literacy program, and we can mention it to the team there, and they can disseminate the message. So right now we're in Barnwell, Orangeburg, and we've got a 3rd year of funding from the USDA for Greenwood and Newberry counties. And so Newberry and Greenwood counties will have right now they're forming their teams together, and soon they'll have Jim and his team this wonderful broadband community champion training. And then by July 2023, they will have their roadmaps, and that will very well include any resources they currently have, and also the resources that many of you on this call and also the panelists provide. And then with the Health Equity Grant, it's a lot of information. We have different communities, some with the digital economy ecosystem, some not, who have received funding from the CDC to look at health in an innovative way. So we're actually providing grants for drone education, also for the Innovation Center, a career center, all for tech-based jobs and also education to create that pipeline. Something I'll never forget, and I think I saw Kay Self on this call in Greenwood, was a visit from a specialist in robotics, and how he took some qualitative data from the high school students in Greenwood, and the high school students, they unfortunately shared that they don't feel like they have a future in Greenwood. They need to move out. So the work that the Office of Rural Health is doing is to help prevent further the youth exodus in rural areas, and to preserve, the culture that they have, and to provide better salaries for those who live there. They don't have to have this long commute to other places. Therefore, building the rural areas. We're very excited to see where this program goes, and to help in any way the ISPs and our fellow partners to make sure that broadband and all of its uses are a success in rural South Carolina.
And Paula, that is to me a great blessing of broadband in rural areas to prevent the brain drain from our rural communities, because if a broadband is fully accessible, you can bring the world to rural communities and also create economies in rural communities. You all have shared some powerful stories of the role that you played in advancing broadband, and I didn't talk at all about what SCACED is doing. And Paula, thank you for sharing our Broadband Community Champion training program that Ken Harvin on our team leads and helps to grow the capacity of rural communities to understand broadband. We're getting close to the end of our time, but I've got one question, and then maybe Madeline may want to lift up a question in the chat. But the ISPs, as Jim has indicated, need to share their strategy of how they're going to engage communities. What would be one key element or key thought that you would share with the ISPs of what they need to know about under-resourced communities? What would be one thing that they would need to consider in their plan that can help under-resourced communities? And I'll start with Kath.
So I would say that, each rural communities are very similar, but they're also very different. So the partners that we work with, say in Williamsburg County, may be completely different than Marion County because their visions or their missions may be a little different. So I'd say each community is just a little bit unique, and you need to find, and all you have to do is find those community leaders and who steps up to the plate that you should be working with, because those trusting relationships are already there, and they can help weave you into that community when you're going to be seen as an outsider. Even if you're in that community providing service, but you're a larger corporation, it's still, there's a mistrust there with some of those communities. So figure out who those hidden community leaders are within each of those rural or underserved areas, and reach out to them in partnership, because they'll be trustworthy partners.
And Kathy, could I add to that maybe it's not just for the application, but it's a long-term relationship that should be built with those trusted leaders. Would you agree with that?
Yes, sir. Totally agree. And I don't think you may not have time between this application to get it in, but I think any of our nonprofits, the three we've talked to today, I do a lot with Phyllis and helping them down in Charleston. Any of them at any point would be happy to partner with you, because you are going to better the lives of the citizens in their community.
Phyllis, what would you add to that?
You all have said the two things that I was going to say, so I will only add that in order to get this work done, we need these public-private partnerships, and we have to enter into the work together, because I think it's really the only way to get it done. And the nonprofit partners can be a liaison to help build a bridge to community over a long period of time. I think the only other thing I would add is that 54% of adults in the United States have low literacy rates. Our data is not that far off from that in South Carolina. And so just be thinking through partnerships, what we can do to help residents understand options in a way that makes it easier and clearer for them to understand not only what's being offered, but how to sustain that over time, what it means what it can mean to their lives, and all of the education pieces that Kathy and Paula have already talked about.
Awesome. And Paula, under-resourced communities, what do ISPs need to know?
I would suggest, that warm introduction. So any organization or coalition who has access to those leaders or coalitions to say, okay, hey, X coalition or X person, this is ISP blank, and this is, having that familiarity is very important. And also the authentic inclusion and transparency, and working on something together. I know that ISPs have of projects within the communities. And the more they include the community in that process and development in the long run, I think that that is key for the ISPs and that success in the community and the underserved communities.
Wonderful. Well, again, thank you all. Kathy, Phyllis, Paula, thank you for your leadership, what you're doing in South Carolina. Madeline, thank you and Together SC for your great leadership and bringing the nonprofit sector to the table with this very critical and timely issue that we're dealing with. And Jim, thank you for being such a good friend and partner to all of us who are trying to advance communities in South Carolina. Turn it back over to Madeline.
Thank you, Bernie, and thank you, everyone. We're a little over time, but for those of you that have the time, I would love to have a follow-up conversation. If you can stay on a few moments and talk about how we could help. A couple of ideas have come in through the chat box, et cetera, particularly for the ISP providers. If you have some ahas of thoughts of how we can help you connect you with folks, we'd love to hear from you on that. If you've got to get off, go on and get off, but we'll keep the recording running in case there's additional ideas. I will say, if you've got a resource you want to share, put it in the chat box. We'll try and get a list of everyone. We know the recording of this will be as important as actually having been here in person. So Jim, thank you and your team and everyone for being here. And everyone have a great day. Stay on if you can continue the conversation.
Thanks, everybody.
Thank you, everyone.
Thanks,
Thank you.
everybody. Thanks,
Thank
Jim. I hope you feel better.
Me too. For those,
So- Go on, Jim.
yeah, Madeline, I was going to say, for those that can hang around for a few minutes, you know, I like to frame it this way, and maybe we can build a bridge between the nonprofits, but it's really expensive to deploy connectivity. And actually, the word we use is community anchor institutions. That's a broad term to encapsulate things like community centers, sheriff's offices, fire stations. These are places, libraries, that a lot of people go. In rural areas, it's really expensive, and I know my ISP colleagues will know, to connect up one of these buildings is a really big deal. But oftentimes the nonprofit leaders can add some icing on the cake, if you will. So if my buddy Glenn, for example, can connect and bring the plumbing, the digital plumbing, into a community anchor institution, then my buddy Kathy can come in and install a telehealth cart, you know, with the resources that she has. So when you think about it like that, there are a lot of one-time grants that the nonprofits can bring to the table to really lift up the infrastructure pieces and bring them to life. And Amy, you guys have probably done stuff like that as well. I mean, I'm thinking, you know, once the plumbing is in a community anchor, a community center, you can put in new equipment for a video conferencing center to train. Have you guys done that?
I actually, something I should have mentioned before, one of our initiatives is the lift zones, where we're wiring community centers or, you know, nonprofit centers to allow, and I think someone else also mentioned something like this earlier. But basically, it's a place where people can go and take care of all this stuff. You know, they, even if they might have internet access at home, they may not really be in a situation where they can either do their homework or do their job search or whatever it might be at home. And so these are centers that where we've provided connectivity, and we've partnered with nonprofit, the local nonprofit organization, community organization, to provide programming as well on top of that. So it's not just a study hall, so to speak. It can serve as a study hall, but it's also, you know, part of our deal in setting those up is making sure that these lift zones offer more than just a place to connect, although that's critical, but it's also a place to, again, receive some of the training we talked about, or assistance with healthcare access and, you know, job searching and resume building, whatever it might be. So kind of all of those things.
So I could see partnering with you guys to do a session like this just for community center leaders. You know, we have to have 6 months of plan time to reach them because, you know, we got 50 people, 70 registered with 2 weeks, you know,
Right.
2 emails got that. But,
Yeah.
you know, if we had 2 months and several, you know, lots of time to let people know about it, I think we could absolutely do special sessions just for people running community centers.
Yep.
I also, in some ways, going to what Kathy's for, every nonprofit staff person should be trained to be a digital navigator. So, you know, anytime we're doing some kind of service with a client, there's the chance to provide some digital assistance in this.
Mhm.
You know,
Hey, from a technical detail perspective, I know Stephen and Glenn, I'll get you guys to comment on this. When you guys design your network plans, you identify community anchor institutions in your grant. And the nonprofits may not be aware of that. When they rope a lasso around a set of geography, they identify every resource that they want to connect. And, you know, Glenn and Stephen, you guys are always looking for sheriff's offices and fire stations, that kind of stuff, right?
Yeah, definitely. Like I said, Jim, you know, last year through the NTIA, a lot of it was, they rolled out some stuff with definitely dealing with libraries and any type of educational institutions. And I know the counties are really focused on connecting their rural fire departments as well. So we're always looking for some type of anchor institutes in those areas we're serving.
well, I put Boys and Girls Club on that list for sure. I don't know if you've, in South Carolina, we've got several strong rural regional Boys and Girls Clubs. And the YMCA's in certain parts of the state are excellent conveners. Many of our members, yeah.
So Madeline, something that Jim referred to, we get a lot of funding for telehealth. And for example, we put telehealth carts in local independent pharmacies. We have a couple of carts in our local housing authority complexes, in churches. So anybody that is willing to partner, if you have a community anchor organization and you want to add a healthcare component to that, reach out to us. Might be that we could add a telehealth cart. We do all the training, the maintenance and everything for that cart. I know Jim's talked a lot about, you know, Main Street, small towns, putting telehealth there, but it's a great place to congregate. We're doing like a drop-in at a church, I think, a couple weeks in September for the folks to come in, and we do a demonstration, show them where they can come into where they're comfortable, right? Bringing it to them where they're comfortable to get health care with their friends and their neighbors. So anybody that's interested that, you can reach out to us.
Kathy, again, that may be another session we need to do like this to get your services in front of all the nonprofits. So,
Madeline, I'll throw another one in there too. You all will be heartened to know that state agencies are actually working together in really cool ways. So we have, you know, one of the other crown jewels of the Office of Regulatory Staff is we also have the Energy Office. And one of the things about the Energy Office is they're looking for places to place electric charging stations. And so we've been working with South Carolina Departments of Parks. And because the parks are great places to have an EV charging station. So guess what? You need broadband to have an EV charging station. So we're looking at, you know, where the parks are and trying to make sure we have good internet resources there to expand the experience, improve public safety, and do some EV charging along the way. So there's tons of ways we can work together if we get creative.
Yeah.
So we're running over. Jim, Natalie has a question. She came in late. It's in the chat box. I bet you can answer it, or your staff can answer it. That would be fantastic. We are thrilled and very honored to have been able to work with you guys today, and that you gave your time helping us to connect nonprofits to the work you're doing. Please call on us if there's anything else we can do. Bernie, I'm sure you would say the same thing. Jim, we're here to make this work as successful as possible. Thank you guys for investing. My big takeaway is that it's not just about putting the access, it's about putting sustainable access and thinking about it from your point of view now. How do we make that community you're investing in with that infrastructure and our state's investing in with that infrastructure, a community that where the service is sustainable, and it's adoption and it's much more beyond that. but I think that's a long-term partnership on that. So, thank you all.